Welcome to the One-Day Surgery Home Care Instruction Series. In this program, we'll cover general guidelines for tympanoplasty and mastoidectomy surgeries, including anesthesia and activity, returning to school, diet, surgical dressings, bleeding and swelling, medications, pain and pain medicines, fever, and the follow-up visit. After we go over these things, your nurse will also review them with you and give you special instructions from your surgeon before you leave. First, let's talk about the general anesthesia your child is receiving today. Anesthesia is the medicine that helps the patient go to sleep for surgery. The effects of this medicine, as well as pain medications, can last up to 24 hours, so it's common to feel sleepy or dizzy during this period. Also, because the hearing organ and the balance organ are related, your child's balance may be affected, and they may have some dizziness for a few days after surgery. This is why certain activities are off limits. For the next 24 hours, patients who have had a tympanoplasty or mastoidectomy, or both, should not drive a car, operate machinery, make important decisions, ride their bicycle, tricycle, go-kart, motorcycle, or play actively with others. After today, and until after the first post-operative visit, your child should avoid any vigorous exercise like heavy lifting, bending, or straining. For example, no jumping on a trampoline, playing baseball, running track, wrestling, or other sports activities. They should also avoid flying and playing musical instruments. And until your post-operative appointment, your child should not swim or get any water in the ear. Avoid having your child bend at the waist, and encourage your child to sneeze with their mouth open. Holding a sneeze builds pressure in their ears and can increase bleeding. Children who are not in a wheelchair or in their parents' arms when they leave the hospital need to have a hand on them at all times in case they begin to feel dizzy or weak. Next, parents are often anxious about how much school will be missed. After surgery, patients are usually absent for 5 days. However, this may be different according to your surgeon. The school excuse will be based on your surgeon's recommendations. If your child is in PE, please make sure that your nurse puts on your school excuse that there is to be no PE until your child has been cleared by the surgeon. Now, let's talk about diet. Your child should begin with a soft diet. If they tolerate things like Jell-O, soup, and applesauce without any problems, they can begin to eat regular food. Sometimes they will have some nausea and vomiting. If there is a problem with nausea and vomiting, once you get home, please call your doctor. Treating these before they become a serious problem will help avoid dehydration. Next, let's talk about what your child may experience after surgery. Your child will go home with a large bandage over the ear. This is called a neoprene dressing. Please make sure your child sleeps in this headband dressing nightly and during naps. This will keep your child from touching or digging in the ear during sleep. If the child is older, the headband dressing may be removed on day 2 after surgery, if there is no drainage present. However, the child must continue to sleep in the headband dressing at night or during naps. Also, please make sure your child's head remains elevated during sleep. This, along with the headband dressing, will help reduce swelling. Once you take the dressing off, your child will either have stitches or a glue-like substance called Dermabond Advanced T. Some patients will have an incision with stitches behind the ear. If there is an incision behind the ear, be sure to clean the incision 2 times a day with hydrogen peroxide and a clean Q-tip. Then apply polysporin ointment to the incision with a clean applicator. If there is any dried blood on the ear, you can gently clean it with hydrogen peroxide and a Q-tip as well. You can only clean the area this way if your child has stitches. Do not put the Q-tip into the child's ear canal at all, ever. If your child has something on the incision site that looks like glue, this is called a Dermabond Advanced T dressing, and you should not use hydrogen peroxide on it because it may cause the clear dressing to come off sooner than expected and cause an infection. Dermabond Advanced T holds the incision closed during the healing process and may stay in place for several weeks. To care for the Dermabond Advanced T, you will need to keep the incision dry. Also, make sure your child does not scratch, rub, or pick at the incision. Doing so may loosen the glue-like substance before the wound is fully healed. Do not apply liquid or ointment medications or anything else to the wound while the Dermabond Advanced T is there. This may cause the clear dressing to come off sooner than expected and could result in an infection. Also, make sure your child does not soak or scrub the wound or get in direct sunlight, and do not use a tanning bed during this time. Now, let's talk about bleeding and swelling. First of all, please know that it's normal to have bleeding from the inside of the ear or from the back of the ear if there was an incision made there. If bleeding occurs, place a piece of sterile gauze over the ear to keep drainage from getting onto the child's clothes or bedding. The gauze may be taped or placed on the inner part of the headband dressing to hold it in place. You may also put a cotton ball at the ear canal opening if drainage is coming from the canal. If bleeding is bright red and more than 2 teaspoons, notify the doctor. You may notice some swelling, especially if there was an incision made behind the child's ear. The swelling will subside in a couple of weeks. However, if you notice the swelling increasing and not decreasing, and there is redness around the incision site, call your doctor. Your child may also experience some numbness after surgery for the next 24 to 72 hours. Also, hearing loss in the affected ear may last up to 6 weeks, but this is a normal part of the healing process. As your child progresses, and when the surgeon says it's okay, your child can take brief showers or baths and wash their hair. Just make sure you help them keep water out of the ear, and if there is an incision, help them keep it dry. After showering or bathing, gently blot the wound dry with a soft towel. If you have further questions about bathing, speak with your surgeon when he comes to talk with you today. After surgery, there may be some medications prescribed. If eardrops are prescribed, follow the directions from the doctor on how to use them. These drops may increase the drainage or change its color, and will also make the packing in the ear canal start to dissolve. Continue using the eardrops until the first post-operative visit. As with most surgical procedures, there will be some pain afterwards. Our goal is to help control pain so that it's tolerable. Typically, pain will last for the next 72 hours. Your doctor will give you the medicine he thinks is best to help control your child's pain. It's important to follow the instructions you are given. You may be given a prescription for your child's pain medicine. You can alternate the prescription pain medicine with an ibuprofen, such as liquid Advil or liquid Motrin, for continuous pain relief. The prescription pain medicine already has Tylenol in it, so do not give any additional doses of Tylenol or acetaminophen. Our next topic is fever. Sometimes after surgeries like this, children will run a fever as high as 101 degrees. Remember, you will already be giving your child prescription pain medication, which probably has some type of Tylenol in it. You're also alternating these pain meds with liquid Motrin or ibuprofen. Together, these medications should combat a low-grade fever. However, if your child is running a fever higher than 101 degrees or is running a fever longer than 24 hours, you need to contact your doctor. By the time a few days pass and your follow-up visit is due, your child should be feeling much better. Your nurse will let you know about your follow-up appointment, which is typically in about 2 weeks. Please take the time to call the office today and schedule it. But in the meantime, if there are problems, questions, or concerns, please call your child's surgeon. During normal business hours, please call the office. However, if it's after hours, the weekend, or on a holiday, please call the hospital operator at 638-9100 and ask them to page the doctor on call for ENT. For emergencies, call 911. Please remember that the information presented here on tympanoplasty and mastoidectomy surgeries covers general guidelines. If your surgeon gives you instructions that are different from what you heard in this video, follow the instructions the doctor gives you. Also, if you have any questions about this information, please ask your one-day surgery nurse. On behalf of the one-day surgery staff and all of us here, thank you for choosing Children's of Alabama.